Hi, my name is LaNia Taylor, and I'm a Tuskegee University nursing student, and today I'm going to be performing my checkoffs on how to start an IV. So before we go into our patient's room and to start this IV, we must look at our MAR before, see what the order is, what we're giving it for, and then after that, we want to make sure that we're just giving it to the right patient. And we're going to check those 6 right, make sure we have the right medication. Well, make sure you have the right person, make sure you have the right medication, the right dose, the right route, the right time, and make sure we have that correct documentation. And also that that is also a right that they have the option to refuse medication. So I guess I would consider it 7. So the 7 rights. We want to make sure that we're looking at those. So then once we see what we're doing and what we're giving, then I would go into my medication room and I would then get everything that I need to prepare for this skill. So today for this skill, I would need an IV starter kit, which has everything that I need: the gauze, tourniquet, tape, dressing, and the core prep that's already in there. And then also I would need a catheter, and today we're going to be using a 22 gauge 1-inch catheter that I have. So I have those 2 things, and for this patient we're going to be giving it an IV. For fluids, we can really give it for anything else. Many other things. I'm sorry, excuse me. We can do it if they are going into surgery. Most of the time, sedations can be given through IV, and also medications. And we just want to be able to have a patent IV while they're in surgery. You can also get it for blood transfusions, if you need electrolytes, certain electrolytes, or if you just need to be rehydrated, which in our patient's case today is that they need just a little rehydration. So that's what we're giving them their IV for. So I need to make sure that my fluids, well, I don't have any fluids today, but if we were giving fluids to a regular patient, I would want to make sure and check those fluids, make sure that they're within range, within that expiration date, so that they are being able to be used. And also for the same thing with the kit, and also with my catheter, I want to check the expiration date before I end up using them. So now that I have got everything that I need, I've checked the expiration date on it, I just want to check one more time before I leave out, make sure I have the right patient, the right medication, all of that. I want to check those rights one more time and check that MAR just to see. So now that I've got that, I'm going to get everything and go ahead and head on to my patient's room. So now I'm in my patient's room. I'm going to make sure I introduce myself. My name is LaNia Taylor. I'm your Tuskegee University student nurse today. And today, can I get your 2 patient identifiers, which is going to be their name and date of birth. So then they're going to give me those. And then once again, that's another chance for me to go ahead and check that MAR, make sure I have that right patient. So then once I've got that done, I will then move on and go ahead and tell my patient what I'm here for today. So let them know that they're getting an IV. They just need to be rehydrated, get some fluids in because they are a little dehydrated. So once I've done that, I'm just going to ask them to go ahead and put their arm in that dependent position because I want the blood to start rushing down to those veins so that I can see better and find a good vein. So while they're doing that, I'm going to go ahead and perform my hand hygiene. So while I'm performing my hand hygiene, I'm just going to make conversation with my patient, ask them, have they ever had an IV before? And if they have, I'm just going to ask them, have they had, how was their experience before? Did they have any bad things that happened? Any reactions? Or if they had a good experience? That's always good also. So I just want to conversate with them. And then also ask them if they have any allergies. Because with IVs, most of the time they do use adhesive tape, and some people are allergic to adhesive tape. So we just want to make sure that we are not giving them something that is an allergy to them. So after I'm done and I've got that little bit of information out the way, I'm then going to go ahead and go to my patient, and I'm going I'm going to go ahead and apply a tourniquet onto their arm. So this is going to be my arm today because I don't have an actual arm to use. So this is going to be it. I'm going to try to apply this tourniquet onto it. So I'm going to apply my tourniquet onto my patient. Please just bear with me. Okay, so now that I've got that tourniquet somewhat on, so now I can see a little better. And then also, if we ever have problems trying to find a vein while we have that tourniquet on, we can always just take an alcohol prep and just wipe across it just to kind of irritate that under, so it'll kind of make those veins be seen better. So now I have found that vein that I know I want to use. So then I'm going to go ahead and take off my tourniquet and just let their arm sit for a little bit. And then I'm just going to go ahead and prep my supplies that I know I will need. So I'm going to just go ahead and open the IV starter kit. I have some tape in here. I have my chlorhexidine prep in here also, and some gauze. So I know that I have all of that ready. And I also have my gloves here with me ready. And I also have a saline flush that I need that I still have in the package. So I just took off the top part so that it's easy for me to grab and to connect when I have my catheter in. So there's that. And then I also already have some tape pulled that I got outside of my inside of there. So now that I have everything that I know I will need and have it in order, which is best for me, I'm then going to go ahead and put some gloves on. Okay, so now that I have these gloves on, I'm then going to reapply my tourniquet onto my patient. Okay, so I've got the tourniquet on. So now that I've got the tourniquet on, I will take my chlorhexidine prep, and just like when we usually clean, we're going to go inner to outer with this as well. Just want to make sure everything's clean because we are going into that bloodstream, so we don't want to bring any bacteria into there. So then I'm just going to let that go ahead and air dry. And while that's air drying, I'm going to go ahead and just make sure, get my catheter and everything together. Make sure everything is prepped how I want it and how I need it. Okay, so now I'm going to go ahead and just take the top off of my catheter. I want to make sure my bevel is up so that the blood can come rushing into it. So, and I also want to taunt the skin, just taunt it towards me, not away from me, because I don't want to accidentally stick myself if I taunt away from me. So I'm going to taunt down towards me. I'm going to go in at a little angle first just to get down in that vein. Okay, I'm down and I'm just going to level out. I've got some flashback. Then I'm just going to slowly advance the catheter and pull that needle out. And then I'm going to go ahead and make sure I occlude first. And then I'm just going to go ahead and pull that needle out of the catheter. Okay. Now that I've got that and I've got it occluded, so I'm going to go ahead and pop my tourniquet. Then I'm going to make sure that I attach this onto here. And now that that's on, I will then take some tape just to stabilize that hub, but still at the same time not touching that insertion part. Okay, and now that I've got that on, at this point I would apply my Tegaderm, but I don't have a Tegaderm right now. And then I would also connect my fluids here, but we don't have fluids at this moment either. So once I would have all of that stabilized and then have the fluids taped down and also have this catheter secured, I would make sure to then go ahead and document everything and make sure that I document the site that I gave it, which arm, where on that arm, what fluids did I give that patient, and things of that nature, and make sure to do that last right, which is document. That is my checkoff on how to start an IV. Thank you so much for watching.